So we're going to tackle class your lesson 10, your sexually transmitted viral infection. So we have two lessons for this meeting. Your STI, and after the STI we have your hepatitis. So for STI class there are two commonly encountered viruses that would cause sexually transmitted diseases. We have your human immunodeficiency virus and your human papillomavirus. Let's start. So let's start first with your human immunodeficiency virus. So human immunodeficiency virus class was derived from the primate lentivirus. When you say primate, this was originally class a zoonotic viruses that were originally found in monkeys. Now, this virus that was originally derived from the lentiviruses in primate monkeys class was later on transferred to humans. As for how it was transferred class, it could be via accidental body fluids. So, pwedeng yung blood ng unggoy nakuha ng tao, something like that. Now, your HIV is the etiologic agent of what we call AIDS, or AIDS would refer to acquired immune deficiency syndrome. So, familiar kayo sa AIDS class in your immunology and serology if it was explained. Yung AIDS nyo class, when you have AIDS, you would have a low CD4 cell count. Now, the illness was first described in 1981 and HIV-1 was isolated by the end of 1983. So, HIV was first detected class in the year 1981. Then, yung first type ng HIV, the first type HIV-1 was isolated by the end of 1983. Wherein there was an increase in the incidence of what we call Kaposi sarcoma and pneumocystis pneumonia. Naalala nyo yung pneumocystis pneumonia nyo? Yung it's caused by the parasite pneumocystis jirovecii. So that would lead to this type of pneumonia. So a characteristic of HIV during that time was KS, or your Kaposi sarcoma, and your pneumocystis pneumonia. Now there are two types of HIV class. We have your HIV-1 and HIV-2. Both of them class are known to cause AIDS. But as of today, class, the type of HIV that has the most information we have about is your HIV-1. HIV-1 class is the one that we know more about compared with HIV-2. The reason, class, is because HIV-1 is the major cause of AIDS worldwide. Now, the treatment, what they did in due to the rising cases of AIDS class, is that they developed highly active retroviral therapy, or your HAART. Now, HAART is used for chronic suppression of HIV replication and prevention of AIDS, which has been a major achievement in HIV medicine. Kaya nga class sa ibang bansa, and even here in the Philippines, if you are positive for HIV, and you were given this type of antiretroviral drugs, you would have no detection of the virus in your blood. So technically, class, safe ka makipag-sexual intercourse even if you are HIV positive. There is low to none chance na makaka-acquire ka ng HIV, provided that you would take these antiretroviral drugs because it would suppress the HIV replication. Now, let's take a look at the properties of HIV. So, the property will have first the virion. So, your virion class would appear as spherical. It has 80 to 100 nanometer in diameter, and it has a cylindrical core. Now, the genome class is a single-stranded RNA genome. It is linear, a positive sense, a diploid, and has 6 additional replication genes. Now, the proteins class would include an envelope glycoprotein that would undergo antigenic variation. It also has the enzyme reverse transcriptase. If you still remember in your mol bio, reverse transcriptase class is the enzyme that would convert your RNA to become DNA. So for your virus, for your HIV to infect a cell, the RNA genome would have to be first converted into a DNA. So reverse transcription enzyme would be found inside the virion, and protease required for the production of infectious virus. Then we have your envelope. This is present with glycoprotein spikes. Replication class would occur in the nucleus of the cell. Other outstanding characteristics class is that the members are non-oncogenic and may be cytocidal and would infect the cells of the immune system. Specifically class, ano yung question? I have a question. The two major types of your immune cells are your T cells and your B cells. So if we go back to the hematopoietic cycle or the hematopoiesis, if you still remember, yung lymphocyte nyo, your lymphocyte would be subdivided into two. We have the large lympho, which is also known as your natural killer cell, and the small lymphocyte. Now, your small lymphocyte, if it stays in the bone marrow, it would become a B cell. If your small lymphocyte matures naman or would go to the thymus, it would become a T cell. Si B cell, if it encounters an antigen, it would become a plasma cell, and the plasma cell would be the one to produce your antibodies. Now, si T cell nyo naman class would have different variations, but the two most common is your CD4 positive T cell, also known as your helper, your T helper, and the second one is yung CD8 positive, which is your T cytotoxic. Now, what they would usually infect class is the T cells. So HIV would infect the T cells specifically, especially the T helper or your CD4 positive T cell. Now, let's talk about the proteins found in your HIV. So, as mentioned earlier, there are 6 additional proteins found in your HIV. Let's first talk about the structural protein. When you say structural proteins, these are the ones that would maintain the shape of your virus. We have number 1, the matrix proteins. It consists of the P17 protein and would lie between the envelope and the core. So the P17 class, ito siya. So it's found between the envelope and the core. So itong blue na to, itong purple na to rather, this is the core. And itong layer na to, this is the envelope. You would find the P17 or the matrix, the P17 protein in between them. So ito siya. This is your P17 protein. Then we have the GAG protein. The GAG gene would give rise to a 55 kilodalton GAG precursor protein, also called your P55. So yung GAG protein na yan, yung GAG protein na yan, yung name niya class is the P55 protein, which is expressed from the unspliced viral messenger RNA niya. Then we have your envelope proteins. These are short term as ENV. ENV proteins class, your ENV protein would exist as a multimer, most likely a trimer in nature, on the surface of the cell of the virion. Interactions between HIV and the virion receptor, which is CD4. So pag tinanong kayo class sa quiz nyo, what is the receptor of your HIV? The answer is CD4. Meaning class, your HIV attach to the CD4 of your T cell, which are mediated through specific domains of GP120. So if you take a look at this picture class, itong parang spike na to, this is your GP120. Now, your GP120 is found in the envelope. Now, whenever it would find a T cell, especially your CD4 positive helper T cell, kunwari ito yung T cell nyo, sa surface niyan class, sa surface ng T cell na yan, merong CD4 receptor. What happens is that your HIV would attach to it, would adhere to it using the GP120. Ito yung GP protein 120 niyan. Yung GP120 na yan, i-attach siya dun sa CD4 receptor, allowing attachment. Then we have your non-structural protein. We have your HIV-1 protease. Now, HIV-1 protease is a aspartyl protease that would act as a dimer. Protease activity is required precursors during virion maturation. Then we have your reverse transcriptase. During the process of reverse transcription, the polymerase makes a double-stranded DNA copy of the dimer from a single-stranded genomic RNA present in the virion. Diba ang HIV nyo nga class as mentioned kanina is a strong single-stranded RNA. Now using that enzyme, yung reverse transcriptase nyo, it would now become a double-stranded DNA. Then we have your integrase protein. The integrase protein mediates the insertion of your HIV proviral DNA into the genomic DNA of an infected cell. So kunwari ito yung cell ng CD4 nucleus. Inside the nucleus, there would be DNA, the DNA of your T cell. Ngayon, ang nangyayari dyan, class, kapag pumasok na or once there is an attachment of your HIV, the single-stranded RNA would be found inside. Magiging double-stranded siya. And then using the enzyme integrase, si integrase class would allow integration or attachment. Mamimix, the viral DNA would be mixed with the cell's DNA. Then we have your regular regulator proteins. We have your TAT or your TAT. TAT class is a transcriptional transactivator that is essential for HIV-1 replication. Then we have your REV. REV is a regulator protein that is 13 kilodaltons with a sequence-specific RNA binding protein. It acts to induce the transition from early to the late phase of HIV gene expression. Then we have your accessory proteins, your VPR, which would block cell division, and your VPU, which increases the release of HIV from the surface of an infected cell. Now, these are the different genes and the proteins being encoded. So, if you still remember again in your mol bio sa central dogma, di ba ang genes nyo? They would start from your DNA. It would be replicated and it would become your RNA. Then later it would be translated into a protein. So for every gene that is being expressed by a cell class or a virus, there are different proteins or products encoded. So itong products encoded na to, these are the proteins. So if the virus has the GAG gene, these are the proteins that it would encode. The P17 protein, the P24, the P7, and the protease protein. Now, each protein class has different function. Si P17, 24, and 7 all have structural function, while your protease has a GAG-POL protein processing. Then we have the POL gene. The POL gene would encode for the following proteins: protease, reverse transcriptase, integrase. We have your GAG-POL protein processing, DNA synthesis, and integration. So these are the functions. Then we have your ENV gene, which would encode for the protein GP120, GP41. GP120 has the function of absorption. GP41 has the function of fusion of envelope with plasma membrane. So do memorize this table, class. This will come out in your quiz. Now let's talk about the replication cycle of HIV. So the replication cycle would always start, class, with the entry of the virus. So they would look for the of the target cell. The target cell, specifically your CD4 positive T cell. So CD4 is your primary receptor for HIV. HIV would embed in the outer membrane and would bind to the receptor of the target cells. Your T cells have CD4 and CCR5 receptor to which HIV can bind. Binding of the HIV envelope protein to CD4 and CCR5 allows the HIV-1 outer membrane to fuse with the cell's outer membrane and contents of the virus particle to enter the cell. To simplify this class, yung HIV nyo daw, once it finds a T cell, it would attach to either CD4 or CCR5. Once it attaches to this receptors class, it would now fuse. Mag-fuse siya doon sa outer membrane, allowing it to enter the cell. Now, once the virus has entered the cell class, there would be what we call fusion and release. So the HIV envelope and CD4 cell membrane would fuse or join together, allowing the HIV to enter the cell. Inside the cell class, there would be reverse transcription. So the genetic material of the virus is in the form of RNA. Now, there are two strands of RNA in each HIV-1 virus particle. Your reverse transcriptase would initiate the formation of one double-stranded molecule of viral DNA by copying the sequence of the RNA strands contained in the virus particle. Again, to simplify class, pag nandun na siya sa loob ng cell nyo, dun sa nucleus, the single-stranded RNA of the HIV would be converted by the enzyme reverse transcription or reverse transcriptase to double-stranded DNA. Then what happens next is the integration of the viral DNA into the cell's genomic DNA. So magmi-mix na class ngayon yung double-stranded DNA ng HIV nyo to the cell's DNA. The viral DNA would enter the nucleus of the host and would become integrated in the host DNA. The enzyme integrase is the key in this process. Once the viral DNA has integrated into the cell's DNA, the cell is infected for the remainder of its life. The integrated viral DNA is now known as your provirus. Then we have your replication. So replication class is where in transcription. So the provirus DNA would serve as a template for the creation of new viral RNA via a process known as transcription. The host cell's own machinery that is normally used for the transcription of human gene is used by the virus to create new viral RNA molecules. The newly formed viral RNA would move out of the infected cell. So sa replication class, di ba, nagkaroon na kayo ng integration. Nagmix na yung DNA ng HIV nyo to the cell's DNA. What happens next is that this DNA class would now replicate. Magke-create siya ngayon ng new viral RNA. Again, transcription yung mangyayari. Si viral RNA niya would now become or would move out of the nucleus. From there, class, ang mangyayari next would be translation. Sa translation, your RNA would now become proteins. So the viral RNA would carry a code for the synthesis of viral protein and enzyme. The code is translated into long chains of amino acid known as polypeptide chain, which would fold to form the protein and enzymes of new virus particles. So your RNA class would become translated to proteins that would be important or that would form your new virus particles. So itong mga proteins na to would now assemble, mabubuo sila class. Now components that are required to build new virus particles, namely viral protein, enzymes, and genetic material, move to the cell's outer membrane where they would accumulate and assemble in the form of a bud. So instead of lysing the cell class, di ba sa ibang virus nila lyse nila or dinidestroy nila yung cell, what happens in this type of replication is that it would happen via budding. So magpo-form yung virus nyo doon sa cytoplasm, and from there, class, it would be slowly released outside of the cell through budding. So how host cell proteins would cut the virus bud from the cell's outer membrane, thereby releasing a new virus particle. During and after assembly and release, a viral enzyme called protease cuts the HIV polypeptide chains at several positions in a process called maturation. To make the finished components of the new infectious viral particle, a single infected cell can release many new HIV particles, which would infect other cells in various parts of the body where the viral life cycle is repeated. The infected cells are eventually destroyed. So ito yung entire process niya, class, in a picture. So first thing that would happen, class, is that here would be your HIV. So your HIV virus would find the CD4 receptor or your CCR5 receptor. Mag-a-attach siya doon, mag-fuse siya sa membrane. Now, mag-a-uncoat siya and i-release niya yung single-stranded RNA molecules niyo. Now, si single-stranded RNA molecules nyo, with the help of the enzyme reverse transcriptase, would now become single-stranded DNA, which would later on become double-stranded DNA. Si double-stranded DNA nyo naman ngayon, class, pupunta siya ngayon sa nucleus ng target cell or ng CD4 T cell. Inside the nucleus, class, with the help of integrase, i-insert niya yung sarili niya dun sa nuclear material or sa DNA ng cell. From there, class, it would start to become a messenger RNA. Your messenger RNA would be transcribed or would later on be transcribed and translated to form proteins. These proteins, class, are basically viral components. So kapag nabuo na yung mga proteins na yan that are viral components or parts of a new HIV virus, lalabas yan ngayon. It would now go outside, it would now go to the cytoplasm, and there it would be assembled. So mag-a-assemble siya, bubuuin niya yung mga parts niya doon, and it would now be released via budding. So instead of destroying the cell, magbabad lang siya, class. Parang lalabas lang siya doon, magkakaroon lang siya ng butas doon sa cell wall nung target cell nyo. But it does not technically destroy the entire cell. So that's the difference compared with other virus. Yung mode of exit niya is via budding. Now, what are the clinical manifestation of HIV? So HIV, class, has four clinical manifestations. So CDC definition of AIDS stated that all patients who are HIV antibody positive and have CD4 T cell count lower than 200 mm cube or millimeter cubic millimeter or less than 14% of total lymphocytes have the disease. So kapag ikaw, class, positive ka sa HIV antibody test, if you're positive for HIV antibody test or if you have a CD4 T cell count less than 200 cubic millimeter or less than 14% of total T cells, you have HIV. Now, HIV, class, has four stages. The first stage, class, are usually patients who are asymptomatic or have persistent generalized lymphadenopathy. Pag sinabi mong lymphadenopathy, class, namamaga yung mga lymph nodes mo. You have an inflamed or you have an enlarged lymph nodes in at least two sites. Usually nasa lieg or usually nasa may bandang kilikili mo or even your inguinal area. And it would last, class, for more than 6 months. So if you have a large lymph nodes in two sites or more for more than 6 months, you are under stage 1. And the problem here, class, is you are asymptomatic. And this can remain for several years. Then we have your stage 2. Now, in early HIV infection, patients may demonstrate several clinical manifestations. Clinical finding in stage 2 would include, so sa stage 2, class, you are mildly asymptomatic. So ito yung mga symptoms niya. You would have unexplained weight loss of less than 10% of your total body weight. Recurrent respiratory infection such as sinusitis, bronchitis, otitis media, pharyngitis. So sa stage 2 class, nagtataka ka na kung bakit you keep on losing your body weight and then you always have respiratory infections, usually sinusitis, bronchitis, and other respiratory infection, as well as a range of dermatological conditions including herpes zoster, flares, angular cheilitis, recurrent oral ulceration, papular pruritic eruptions, seborrheic dermatitis, and fungal nail infection. So if you still remember class, yung herpes zoster nyo is also known as your shingles. So shingles nyo is a reactivated chickenpox. So that's a possibility na mangyayari sa stage 2. Marireactivate yung chickenpox mo, magkakaroon ka ng herpes zoster or shingles. And yung pinaka-worst dito class, itong seborrheic dermatitis. Pag sinabi mong seborrheic dermatitis, sa sobrang ng itchiness ng balat mo, too much itchiness or pruritus would lead to having your fat layer being visible. So yung itsura niyan class, you would have a reddish skin with a bit of yellowish fat being visible. Then we have your stage 3. In stage 3 class, as the disease progress, additional clinical manifestation may appear. So, dito na yung moderately symptomatic stage. So, sa stage 1, asymptomatic ka. Sa stage 2, mildly symptomatic. Sa stage 3, moderately symptomatic. So, again, you would have weight loss of greater than 10%, prolonged unexplained diarrhea. So, you would always have constant diarrhea. You now become positive for pulmonary tuberculosis, severe systemic bacterial infections, including pneumonia, pyelonephritis, emphysema, EMPHYSEMA, pyomyositis, meningitis, bone and joint infections, and bacteremia. You would also have mucocutaneous conditions including recurrent oral candidiasis, oral hairy leukoplakia, and acute necrotizing ulcerative stomatitis. Gingivitis, periodontitis may also occur. So dito sa stage 3 class, aside from having skin problems, so may skin problems ka na, may respiratory problems ka na, you would now start having mucocutaneous problems or issues. Pag sinabi mong mucocutaneous problems, this would usually involve the mouth and the nose. And one characteristic of that is your oral candidiasis. Ang pinaka-rare kadiri tingnan dito kasi class, pag may oral candidiasis ka, you have a very bad breath, tapos yung entire tongue mo is namumuti na. Then we have your stage 4. So stage 4 is the severely symptomatic stage. This is where all AIDS-defining illnesses would occur. So clinical manifestation would include presumptive diagnosis of AIDS based on clinical findings alone. So we have your HIV wasting syndrome, pneumocystis pneumonia, also known as your PCP, recurrent severe or radiological bacterial pneumonia, extrapulmonary tuberculosis. When you say extrapulmonary tuberculosis, di ba, TB would normally or would usually affect the lungs. But when you have extrapulmonary TB, you can have TB of the bone, TB of the eye, TB of the skin, and other extrapulmonary. Basically, you will have TB outside your lungs class. Then we have your HIV encephalopathy. So this is starting to affect the brain. Then we have your CNS toxoplasmosis. If nalala nyo sa parasitology nyo, si toxoplasma. So toxoplasma, when you inhale something from cat feces, yung spores niya, you could develop this type of disorder. which would affect the brain. Then chronic or more than 1 month or orolabial herpes simplex infection. Then we have your esophageal candidiasis and Kaposi's sarcoma. Other conditions that would should arouse suspicion that a patient is in this clinical stage would include CMV infection. So positive siya sa CMV class. There would be retinitis or infection of organs other than the liver, spleen, or lymph nodes. Then extrapulmonary cryptococcosis, disseminated endemic mycosis such as your coccidioidomycosis, penicillosis, and histoplasmosis. Cryptosporidiosis, isosporiasis, disseminated non-tuberculosis mycobacterial infection, tracheal, bronchial, or pulmonary candida infection. So if you notice, class, ang main type of diseases in stage 4 are mostly your opportunistic fungi. Sila Cryptococcus nyo, si Coccidioido, and so on. There are even cases of systemic mycosis. So this is the disease progression of your HIV. So on the lower part on that axis, you would find the time. You have the weeks and you have the years. On the left side, itong axis na to, you would find your CD4 cell count. So at week 0, class, week 0, nakipag-sexual intercourse ka with an HIV individual. This is the start of your acute phase. Now, as the weeks go by, you would see a starting after week 6. At week 6 class, let's say you have around 900 cubic millimeter of T cell, CD4 T cell. Starting from the seventh week onwards, unti-unti na siyang bumababa. There would be a sharp decline starting from the seventh week until it reaches 1 year. At 1 year class, you would have around 400 cubic of T cell, CD4 T cell. From there, 1 year onward class would now be the start of your chronic phase. Sa chronic phase class, continuous yung pag-fall ng CD4 T cell count niya until it later on develops to become AIDS. Now, during AIDS, tataas na yung viral viral count nyo. Tataas na yung viral count nyo until there would be the death of the individual. So napakabilis lang ng progression ng sakit niya, class, if you notice. It would last as the patient would normally die. Ang pinaka earliest is 1 year to 2 years. And ang pinaka longest niya would have to be a decade. So isang dekada, class. So yung blue na yan yung CD4 nyo, yung pula yan yung viral count nyo. Now, let's talk about the epidemiology of HIV. So, AIDS was first recognized in the United States in 1981 when it became apparent that an unusual number of rare skin cancers, Kaposi sarcoma, and opportunistic infections were occurring among male homosexuals. Kaya dati, class, ang HIV nyo, it was known as your GRID or your gay-related immunodeficiency disorder. So, kasi common nga siya sa mga male homosexuals. Then, syempre, sobrang bias naman ng name na GRID. So, they changed it into AIDS. Now, these patients were found to have a markedly reduction in CD4 T cell and were subject to a wide range of opportunistic infection, normally controlled by an intact immune system. The disease was found to progress relentlessly to a fatal outcome and was first identified in male homosexuals, hemophiliacs, who were receiving blood-derived coagulation factors and injection drug users. So very common sila, class, on homosexuals, hemophiliacs, yung mga gustong sinasalina ng dugo, and drug users that would use injectables or injections. Now, HIV class is transmitted through the following: unprotected sexual contact with an infected partner, exposure of broken skin or wound to infected blood or body fluids, transfusion with HIV infected blood, injection with contaminated objects, then mother to child during pregnancy, birth, or breastfeeding. Now, during my time class when I was a student, merong kwento, there was a story sa recto. There was a student daw na she suddenly felt a piercing pain, a piercing pain sa arm niya. Now, upon checking, nung nakita niya yung piercing pain niya, merong small needle. Di ba nakakita na kayo ng, ano ba tawag dito? Tuberculin. Nakakita na ba kayo ng tuberculin syringe? So, it's a very small needle class, a very small syringe. Siguro mga 0.1 ml yung na-aspirate niya. So, that tuberculin syringe was found in her arm. And later on, na-notice niya parang may dugo dun sa loob ng syringe. So, nagpa-test yung babae. And later on, she became HIV positive. So, siguro trip lang nung HIV positive na patient na yun na ikalat yung sakit niya. That's why ginawa niya yun dun sa ibang tao. So, that was a story during my time when I was a student. Pag naglalakad ka daw sa recto, be careful of your surroundings. Something like that. Now, what are the lab diagnoses for HIV? So we have your serologic method. So antibodies to HIV can be measured by a variety of techniques. None of these detect HIV itself, but rather detect an immune response to the virus, and therefore take some time to develop and become reactive or positive after HIV infection has been acquired. Take note of this class itong statement na to. It would take some time to develop and become reactive. The reason why it takes some time bago ka maging reactive sa sakit na to is because your virus has what we call a window phase. During the first 6 weeks, during the first 6 weeks class, your HIV antigen is not detectable. Kaya nga nakakatakot during internship if you're accidentally pricked or kung meron ka naka-sexual intercourse na may HIV, then later mo lang nalaman, you have to wait for 6 weeks before you could confirm kung positive ka or negative. You have to wait for 6 weeks, at least 6 weeks, before you could know if you were infected. So, syempre, mag-overthink ka, mapapaisip ka ng mapapaisip. So that's one problem with this virus. Merong window phase. It takes some time before you could detect the antigen or the antibodies. Now, antibodies to HIV 1 and 2 are detected by your enzyme immunoassay, also known as your ELISA or your enzyme-linked immunosorbent assay. So, di ba sa immunosero nyo nung midterms, discuss yung enzyme immunoassay. In enzyme immunoassay class, one test under that is yung ELISA nyo or your enzyme-linked immunosorbent assay. Yung gagamit kayo ng mga wells class. Tapos magwa-wash kayo. Gagawin nyo rin yan sa CC2 lab nyo for the T3 and T4. Now, nowadays class, meron silang mga simple rapid devices. So, pakitandaan class, tinatanong sa board exam kapag screening tests for HIV, it's your ELISA. Kapag confirmatory tests, so ang rule kasi class, kapag nag-positive ka sa screening test ng HIV or sa mga rapid test kits, you need to perform a confirmatory test. So the confirmatory test is Western blot assay or Western blot test. Then another method na ginagawa ngayon is yung nucleic acid detection. So for nucleic acid detection, they would use different methods or techniques. So the most common is your PCR or your polymerase chain reaction. It exponentially amplifies the DNA target by many orders of magnitude by cycling the temperature of the reaction several times. So naalala nyo sa PCR, di ba class, may mga cycles yan. May mga thermocycles yan. So for every cycle, it would continuously multiply or amplify the DNA. Now, DNA primers would define the region of the target sequence to be amplified by the DNA polymerase that duplicates the number of sequence in each cycle of the reaction. In the case of RNA specimens such as HIV, the RNA must be converted to DNA class. So kung RNA is to be converted to DNA, ang method na gagawin nyo is your reverse transcription PCR, wherein you would use the enzyme reverse transcriptase before you could do the amplification. Then we have a newer method class, yung tinatawag nilang NASPA. NASPA stands for Nucleic Acid Sequence-Based Amplification. Sa NASPA, you would selectively amplify the target RNA through an isothermal production of an intermediate DNA by reverse transcriptase. This DNA would serve as a template for the cyclical amplification of RNA using an RNA polymerase. Fluorescent labeled probes would hybridize to newly stranded RNA, and quantification is determined by comparing the fluorescence of the target with internal standards. Then there's what you call your branch DNA. It is based on amplifying the signal rather than the target RNA. Then we have your TMA or your transcription mediated amplification. This is a qualitative method that can detect either RNA or DNA. It uses the same principle as the NASPA methodology. Now, kindly memorize this table, class. This will definitely come out in your quiz. So, for treatment of your HIV, di ba meron nga yung HAART, yung antiretroviral drugs. Now, yung antiretroviral drugs nyo, class, each one of them has a groupings. When I say groupings, yung groupings na yan, they have a functional, they have what we call a functional grouping. So, lahat sila may functions, class. So, let's say yung mga retrovirals that would inhibit nucleoside reverse transcriptase. So, i-inhibit nito, or this would prevent reverse transcription from occurring. Meaning, class, your RNA, your viral RNA will not become double-stranded DNA because yung reverse transcriptase nyo is being inhibited. So the antiretrovirals would include abacavir, didazosin, emtricitabine, lamivudine, stavudine, tenofovir DF, sidovudine. So all of those antiretrovirals would inhibit nucleoside reverse transcriptase. So iba pang, there are other groups. So do memorize them, class. They will come out in your quiz and exam. Now let's go to the second type of sexually transmitted viral infection. We have your human papillomavirus. Now, human papillomavirus, class, is a very common virus that can be spread from one person to another person through anal, vaginal, or oral sex, or through other close skin to skin touching during sexual activity. There are about 43 million HPV infections in 2018, many among people in their late teens and early 20s. Nearly all sexually active people who do not get HPV vaccine would get infected with HPV at some point in their lives. So, ang HPV class, kilala sila, they are known to cause warts, genital warts, and sa babae, they are known to cause cervical cancer. That's why sa babae class, you're required to have HPV vaccine because of the reason kasi pwedeng mag-develop yan into cervical cancer. But also for men, tayong mga lalaki class, we are also required to get HPV vaccine to prevent the development of these warts. So yung warts class, they could develop in any part of your body. They could develop in your hands, in your feet, and so on. Now, what are the properties of your HPV? So the virion would be icosahedral, 55 nanometers in diameter. The genome is double-stranded DNA and would appear circular. So circular yung genome niya class. It has two structural protein. It has a cellular histone that would condense DNA in the virion. It is non-envelope. Non-envelope. Replication would occur in the nucleus. Now, characteristics is that they would stimulate cell DNA synthesis. So, kaya niyang i-cause yung kaya niya mag-cause ng DNA replication plus uncontrolled DNA replication. That's why it is known to cause yung warts. So, dadami yung cell class hanggang sa parang maging abnormal tissue siya or abnormal cell leading to your warts. Now, restricted host range and tissue tropism. So it has a very restricted host range. It is a significant cause of human cancer, specifically cervical cancer. Viral oncoproteins would interact with cellular tumor suppressor proteins. So, pathogenesis class. So, HPV would target, please take note of this, would target the stratified squamous epithelium to the damaged area of the epithelium and would infect the basal cells. So, kung ito yung squamous stratified epithelium mo, under that class you would find your basal cells. So the virus would enter to the broken skin, infecting the basal cell. Kaya nga pag may warts kayo class, pag may warts kayo, the more you try to destroy the warts uh, without freezing it, the higher the chance that it would spread the virus. Kasi yung broken skin na yon would further cause the virus to spread to the body. That's why if you have genital warts or if you have warts, ang usually ginagawa ng mga dermatologists is that they would freeze. They would freeze the entire area of the HPV or the wart area to prevent it being spread. Now, although the incidence of infection is high, most infections would resolve spontaneously. Now, a small proportion of infected persons would become persistently infected. Persistent infection is the most important risk factor for the development of cervical cancer precursor lesions. So may mga population ng tao class that they would continuously have HPV infection. So lagi silang nagkaka-warts, lagi silang nagkaka-genital warts. And because of that class, you would be more prone to develop cervical cancer. So the most common clinical significant manifestation of a persistent genital HPV infection class is a cervical intraepithelial neoplasia or CIN. Within a few years of infection, you would have low-grade CIN. Low-grade CIN1 is also called CIN1 class, which may develop and may spontaneously dissolve and the infection is clear. Persistent HPV infection, however, may progress directly to high-grade CIN, also known as CIN2 or CIN3. This is characterized by a risk of progression to cancer and are considered cancer precursor. A small proportion of high-grade abnormalities spontaneously regress, and if left undetected and untreated, years or decades later, CIN2 or 3 can progress to cervical CA. Infection with one type of HPV does not prevent infection with another type. Of persons infected with mucosal HPV, 5 to 30% are infected with multiple types of the virus. The problem with HPV kasi class, marami siyang serotypes. It has a lot of serotypes class. So ito yung mga serotypes niya. So most HPV infections are asymptomatic and would result in no clinical disease. Clinical manifestation of HPV infection would include anogenital warts, recurrent respiratory papillomatosis, cervical cancer precursor, and cancers, including cervical, anal, vaginal, vulvar, penile, and some head and neck cancer. So, ang pinaka-common dito, class, known to cause your warts sa paa, class, si HPV1. HPV1, class, is known to cause plantar warts. And itong warts na to are usually benign. So, pag sinabi mong benign, it would not develop or it would not metastasize. Hindi siya mag-i-spread, hindi siya invasive. While HPV types 2, 4, 27, and 57 is known to cause the common skin warts. Benign din sila. Then we have your 5, 8, 9, 12, 17, 20, 36, 47. They would cause epidermodysplasia verruciformis. It's mostly benign, class, but in some cases, it could become malignant. Then 6, 11, 40, 42 to 44, 54, 61, 70, 72, and 81 would cause the following: anogenital condyloma, laryngeal papilloma, dysplasias, and intraepithelial neoplasia. It is a very low chance, class, of developing cancer. A very low chance of developing cancer. Then we have your HPV type 7, usually found in the hand, or warts found in the hands of butchers. Low chance also of causing cancer. HPV type 16 and 18, class, can progress to high grade dysplasia and carcinomas of the genital mucosa, laryngeal, and esophageal carcinoma. Has a high correlation with genital and oral carcinoma, especially cervical cancer. Then 30, 31, 33, 35, 39, 45, 51 to 53, 56, 58, 59, 66, 68, 73, and 82. All of them could also progress to high-grade dysplasia, carcinoma of the genital mucosa, laryngeal, and esophageal carcinoma. Moderate correlation with genital and oral carcinoma, especially cervical cancer. Moderate correlation with genital and oral carcinoma, especially cervical cancer, considered high-risk HPV type. So itong two groups na to, class, itong 16 and 18, then 30 and so on. These are the two groups known to cause cervical CA. Sila yung two groups of warts, class, or HPV type that can develop later on into cervical cancer. So lab diagnosis, class. So HPV, class, is not isolated or has not been isolated in viral culture. So for you to detect this, class, you would have to test for HPV DNA. So there's what you call nucleic acid detection. So you would use nucleic acid amplification methods. So yung PCR assay is the most commonly used in epidemiological study. They target genetically conserved regions in the L1 gene. Now, results are reported as positive or negative and are not type specific. Yung HC2 test, class, itong digene hybrid capture 2, is approved for the triage of women with equivocal Papa Nicolau test result. And in combination with the PAP test for cervical cancer screening in women 30 years of age and older, the test is not clinically indicated nor approved for use in men. So usually, if you want to identify if meron kang may possibility ka, class, to develop cervical cancer, yung pinaka-common na ginagawang test related to histology or histopathology is yung pap smear. Your Papa Nicolau smear. So gagawin ng gynecologist nyo, kukuha siya ng swab sa lining ng urethra nyo. Then it would be placed on a slide. tapos i-stain nyo, then the pathologist would view it under a microscope. So they would look for abnormal cells. Then we have your serologic method. So the most frequently used HPV serologic assay are VLP-based enzyme immunoassay. However, lab reagents used for these assays are not standardized, and there are no standards for setting a threshold for a positive result. Then we have your cytologic method. So most cases and deaths from cervical cancer can be prevented through detection of precancerous changes within the cervix by cervical cytology using the pap test. Currently available pap test screening can be done by conventional pap or liquid-based cytology. CDC does not issue recommendation for cervical cancer screening, but various professional groups have established recommendation. So according to one group class, yung American College of Obstetrician and Gynecologists, as well as the American Cancer Society and the US Preventive Service Task Force, is that all women, lahat daw ng babae class, should have a pap test for cervical CA screening within 3 years of beginning sexual activity. So kung nakikipag-sexual intercourse ka na at the age of 18 class, you should start having pap tests or when you reach age 21, whichever would occur first. While the USPSTF recommends a conventional pap test at least every 3 years, ACS and ACOG recommend annual or biennial screening of women younger than age 30. So if you are less than 30 years old class, you are recommended to have a pap test every year or twice a year. Women over age 30 with three normal Women over age 30 with three normal consecutive pap tests should be screened every 2 to 3 years. The use of HPV vaccine does not eliminate the need for continued pap test screening, since 30% of cervical cancers are caused by HPV types not included in the vaccine. Now, epidemiology class HPV infection would occur throughout the world. Humans are the only natural reservoir. It is transmitted by direct contact, usually sexual, with an infected person. Transmission would occur most frequently with sexual intercourse, but can occur following non-penetrative sexual activity. Studies of newly acquired HPV infection demonstrate that infections would occur soon after onset of sexual activity. Genital HPV infection would also may be transmitted by non-sexual route, but it's very uncommon. So non-sexual routes class would include transmission from the mother to a newborn infant at the time of birth. HPV is presumably communicable through acute infection and during persistent infection. This issue is difficult to study because of the inability to culture the virus. Communicability can be presumed to be high because of the large number of new infections estimated to occur each year. Treatment, prevention, and control class. So there is no specific treatment for HPV infection. Medical management would depend on the treatment of the specified clinical manifestation, such as genital warts or abnormal cervical cell cytology. HPV transmission can be reduced but not eliminated class with the use of physical barriers such as condoms. Reduction of HPV infection among humans after initiation of sexual activity when their partners would use condoms consistently and correctly. Abstaining from sexual activity is the surest way to prevent genital HPV infection. For those who choose to be sexually active, a monogamous relationship with an uninfected partner is the strategy most likely to prevent future genital HPV infection. So that ends your lesson 10 class, your sexually transmitted viral infection.